Mobile Infirmary with Dr. Bohm with Cancer Surgery of Mobile. So we're talking about the breast cancer department that you have here, the work that you do with breast cancer patients. Tell us a little bit about that.
The breast cancer work that we do here at the Mobile Infirmary is a multidisciplinary team approach. I can't emphasize to you how many people are involved in taking care of the breast cancer patient, as opposed to many years ago when basically the patient saw a physician and the physician managed everything and there was no other involvement. Now we have a very strong team approach here. We're a nationally accredited program for breast centers, and we follow very closely defined guidelines and standards to maintain that accreditation. For instance, we have a nurse navigator now, a geneticist now, a genetic counselor who does risk assessment, a genetic evaluation, and that kind of thing. We have people in rehab, we have people in survivorship, we have people in palliative care, we have financial assistance advisors. There's so many, I can't list all of the people that we have that are involved in our program now.
So what does that all mean for the patient? You describe all these things. When they come here for treatment or to learn what's going on, what does this mean for their overall experience while going through this difficult time?
It means they get better care. They hear about more treatment options, and they have a more comprehensive approach and learning experience about their breast cancer. There's a lot of education that goes on. Patients learn about the clinical stage of their breast cancer. Their situation is discussed at a multidisciplinary breast cancer conference. We have pathologists there, radiologists there, medical oncologists, radiation oncologists, plastic surgeons, and breast surgeons that are there that discuss their case.
One of the things that we know with breast cancer, as well as all the other cancers out there, is that early detection is the key. Talk to us about mammograms and your advice and recommendations on that.
Mammograms are a very important part of the treatment of the breast cancer patient. Obviously, if your tumor is picked up first by mammography versus a tumor that you feel, you're dealing with a more favorable and earlier stage cancer. So we recommend that patients that are 40 to 45 years old start screening mammograms and continue that on a either yearly or bi-yearly basis, depending on what their risk status is. When patients go to the breast center now, they have a thyroacusic risk assessment, so they get a pretty good look at what their risk for the future development of breast cancer is. If that figure falls into a category higher than 20%, they fall into a high-risk category, and we have a special clinic here, a high-risk clinic, where we follow those patients, and they give them a plan for the future imaging studies that are optimal for their situation. They do the genetic testing. Do they have a BRCA1 or 2 breast cancer? Do they have a high-risk situation based on genetics? And they're taught about things they can do as far as diet goes, as far as exercise goes, and we set up a schedule for the imaging that they're to follow.
What does that mean for you and your staff here to know that you've done everything you could and you've been successful in helping them move forward with their lives?
It's obviously a very good feeling to see someone that's had a devastating illness go through all the treatments that have been recommended and then come out with a good response. And patients obviously feel very good about that too.
Everybody feels good about it. Matter of fact, so good that we want to throw a celebration. So, the 3rd annual Survivor Soiree is coming up October 11th from 5 to 6:30 p.m. at the Breast Center at Mobile Infirmary. If you'd like more information about that, you can find that on the Studio 10 tab at fox10tv.com. Certainly something to be celebrated. Thank you so much, Dr. Bohm. We appreciate it.
You're very welcome.